Good afternoon and welcome. My name is Tim Poe. I'm Director of Telehealth with the UNC Cancer Network. Thank you so much for being here today for our Community College Lecture Series. I do want to go over a few things before we get started. If you are having any technical problems at all, you can email us, unccn@unc.edu. You can also follow up with us later after the presentation. You can call or text us at 919-445-1000. That will get you straight through to our team. You can use Poll Everywhere for the Q&A, and we'll talk about that more in just a moment. We're on the web at unccn.org. You can find us on Facebook. You can find us on Twitter. All right, we're going to start off in just a couple of minutes with a question, a poll question, and this does two things. One, it gives you an opportunity to let our guests know a little bit about what you know in relation to resources for oncology. It also gives you a chance to essentially fire up your mobile phone so that you can use it later in the presentation for the Q&A. So you're going to text to the number 22333 with the letters UNCCN. So you're texting UNCCN to the number 22333. You do that one time. That joins you to our Poll Everywhere poll. And then after that, you can just answer A for true or B for false to the following question. Patients and their families often have difficulty understanding and knowing what their needs might be throughout the cancer experience. So if you think that's true, you'll go ahead and indicate A and send that B and false, and then we'll take a look at the live information on your responses to that poll in just a couple of minutes. All right, so with that in mind, I do want to introduce our guests today. So we have Jenny. Let me go ahead and switch to our guests as I introduce them. So we have Jenny Hanspel, RN, BSN, OCN, Nurse Navigator, Comprehensive Cancer Support Program, Patient and Family Resource Center. We also have with us today Julia Rodriguez O'Donnell, LCSW, Oncology Outpatient Social Worker at UNC Social Work. We also have Cindy Rogers, JD, Oncology Patient Assistance Coordinator, Comprehensive Cancer Support Program, Patient and Family Resource Center. And we have Michelle Gardner, PharmD, BCOP, CPP, Oncology Pharmacist, UNC Hospitals. So I wanted to take a moment for each of our guests and ask them what drew them to a field that's related to oncology. And Jenny, if we could start with you, please.
Sure. Well, good afternoon and welcome. I was initially drawn to the nursing field because I wanted to do something in human social services, and I initially started my career out as a recreation therapist, but then went back to nursing school and then started my career here at UNC in the operating room and quickly found out that I did not appreciate seeing people in and out quickly, and I longed to see folks over the continuity of their care within healthcare. So oncology was a perfect fit for me.
Great, thank you. And Julia, same question?
Yeah, good afternoon, everyone. I was drawn to working particularly in a hospital setting with our oncology patients. It's a time in people's lives that is extremely stressful and overwhelming from an emotional standpoint, physically, mentally, spiritually, socially, and it's a really incredible time to be able to step into people's lives and provide them with some additional support, and I also really enjoy the multidisciplinary team aspect.
All right, thank you. And Cindy?
Hi, good afternoon. I actually worked as a respiratory therapist for 12 years before switching to law as a career, and was really excited when the opportunity came to work with the Comprehensive Cancer Support Program and being able to combine both my healthcare background and my legal background in working to impact patients' lives. So it's a great opportunity.
Great. Thank you very much. And Michelle?
Oh, hi, good afternoon. So right out of college, I was actually a middle school teacher for a couple of years, and that was the day-to-day classroom management was kind of a bit intense, and I kind of decided I didn't want to be in education for the rest of my career. So I went back to pharmacy school, and I worked several jobs, but this one had been around for like 8 years. I had seen other pharmacists with this position. I was very excited to have the opportunity to work in the oncology infusion clinic, and just like everyone else has spoken to, just it's a time in people's lives where they really need a lot of assistance, and especially specific to pharmacy, it's a time to help people learn about their medications, and often people have never really had to use medications before, help them understand how to get the most benefit out of them.
All right. Thank you so much. Well, we know that resources can play an incredible role in the patient's life and the life of the work that's being done by healthcare practitioners. And so with that in mind, we're looking forward to our group of professionals here explaining to us what sorts of resources are available and really how to make sense of those resources. And because as we know, anytime you get on the web, there's this plethora of resources, and how do you really direct yourself and your patients to the resources that are most relevant. So with that in mind, I'm going to turn this over to you, Jenny. And before we actually, one thing I forgot to do, let's look at our poll and see what our audience says. All right, so we've got, I think we're heavily leaning in one direction here. Okay. Great. So, and we'll let you go ahead and begin the presentation. Let me give you the cursor as well in case you need that.
All right. Okay, well, again, welcome, and thank you for joining us today for this collaborative presentation on finding and accessing community resources for patients and their families. I'm Jenny Hansball again. My role here at the Cancer Hospital is as a nurse navigator with the Comprehensive Cancer Support Program. We are also known as UNC Cancer Hospital, North Carolina Cancer Hospital, and the UNC Lineberger Comprehensive Cancer Center. All of that means the same thing. So it can be one additional confusing things when patients are trying to get connected to the right resources. Today we're going to talk with you about a variety of topics, including strategies for identifying valid and trustworthy cancer information, health insurance, Medicaid, Medicare, disability information, medication and pharmacy assistance, employment and legal assistance, and psychosocial and survivorship support. For many, being faced with a cancer diagnosis can feel like a maze. It can be difficult for patients to anticipate the complexity of working with a large healthcare team made up of many different doctors and treatment team members, and understanding the variety of treatment options like surgery, radiation, and chemotherapy, and how to manage and cope with the long and short-term side effects that may result from certain cancer treatments. I love this picture because I feel it captures the roller coaster of cancer care, which can start out like a thunderstorm, a shock with initial diagnosis, and then traveling through chemotherapy, still storming away, recovering from surgery, and it starts to clear up, then navigating through radiation, where there's more of an end in sight, and then ideally back on the road again after treatment ends. Still the same person in the pink car, but definitely changed. The complexity of cancer care often causes distress in patients. Many of you are familiar with the 6 vital signs that we assess on patients, like blood pressure, heart rate, respirations, temperature, oxygen saturation, and pain. Well, distress has actually been considered to be the 7th vital sign in cancer care. Distress can be caused by challenges with practical issues, like trying to coordinate transportation during treatment, how to pay for medication, securing affordable child care, trying to balance life and work through treatment to maintain employment and income. Distress can also be caused by emotional issues, coping with the changes in one's physical abilities, family problems, or spiritual distress. But in addition to being the only public hospital in North Carolina, UNC is proud to be one of the 47 nationally recognized National Cancer Institute Comprehensive Cancer Centers. We are a public academic medical center, which means a teaching hospital, and that means we have a commitment and a connection to teaching medical, nursing, and allied health students, in addition to conducting research. In 2012, the American College of Surgeons released new cancer hospital accreditation standards, requiring that all patients be screened for distress to identify any psychological, social, financial, or behavioral concerns that might interfere with a patient's treatment plan or adversely affect a patient's treatment outcomes. The screening tool that we use here at UNC was developed by the National Comprehensive Cancer Network, called the distress thermometer, which is what you see on your screen. We give this survey to each oncology patient prior to their medical appointment, and it allows them to identify any challenges that they may be experiencing. A staff member then connects the patient to the appropriate support resource like a dietitian, a chaplain, a financial counselor, a social worker, then to address those issues. One of the concerns that many patients and families have when they're faced with a new cancer diagnosis is how and where to find reliable and trustworthy cancer information. We encourage our patients to find an organizational system that will work for them to keep all their information related to their diagnosis, their treatment, their medications, appointments organized. At UNC, one of the tools that we give to folks is a new patient binder, which is the third image there on the screen. And that includes important contact information, hospital maps, information on parking, lodging, cafeterias, descriptions of who makes up their healthcare team, what the difference between a nursing assistant and a nurse is, and tools for organizing their treatment plan. There are other cancer support websites like cancer.net that have apps with tools for managing cancer care, medication, and tracking symptoms. So for more information, just search cancer.net. And again, there's a great deal of information out in the world that patients receive from friends and family, from the patient's healthcare team, and online. I think one patient captured it nicely when she said, "At first I felt overwhelmed, but once I gathered information, I felt comfortable talking with my doctor about my cancer, and I felt ready to make decisions about my treatment." Encourage your patients to be self-advocates and not shy away from asking questions. It can be very helpful for folks to bring a friend with them to their appointment, to be a second pair of eyes and ears. After hearing you have cancer from your doctor, many patients don't hear anything else that their physician says after that, as a result of being in complete shock or disbelief. So having a friend accompany them to the appointment can be helpful. Also, encourage your patients, especially those who don't have internet access, to visit their county public library or their public health department, their community center or a senior center. They often also have information on cancer prevention programs, support groups, and other wellness information. Their local hospital or hospital library also might have some resources in terms of financial assistance or educational offerings. So when you're working with patients and you're assessing their informational needs, one of the first questions to ask is, what kind of support or resources are you looking for? Is it cancer-specific information like treatment options, diagnostic tests, how to manage common side effects at home? Most cancers have a national support organization that have a local chapter that they can connect with. Maybe your patient is looking for information on how to manage practical issues like we already spoke about, managing employment or filing for disability, questions about insurance, how to create healthcare power of attorney or advance directives, or how to connect with home health or help in the home, which are two very different requests. Maybe there are questions focused more on finding emotional or coping support, how to deal with the fear or anger or anxiety or sadness or sometimes hopelessness that accompanies a cancer diagnosis, how to adjust to the changes in physical stamina and appearance, changes in their self-perception, their identity, sexuality, relationships, or concerns about spiritual beliefs and priorities about what's important to them. Finally, patients might have questions related to the time after their treatment ends, which is typically referred to as cancer survivorship, about what's next, how to resume life after treatment. Many folks might have questions about how to live with metastatic disease and continue to do things that are important to them. Ultimately, knowing that cancer presents an unwanted crisis in the life of anyone, knowing how to move forward, mobilize resources and support and help can be very stabilizing and empowering. So in the interest of time, this is a list of UNC and North Carolina websites that we have found to be very credible and informative. The UNC Cancer Network has a patient and family video education library on our website with multiple lectures for health professionals, as well as a patient education series called Lunch and Learn on a variety of topics like staying healthy after cancer, learning about clinical trials, dealing with chemo brain, coping with cancer through the holidays. All of they're very, very interesting, very informative, and you can access them from any device at any time. This is just to show you that because the needs of our cancer caregivers are so very, very important, we created a website specifically designed for our cancer caregivers, and that's how to get access to that. And of course, there are several national cancer resources, all of whom offer education and peer support. The ones listed here are ones that we feel are the most trusted and valid, so please visit them for more information. Many of them have a Spanish translation version as well. I think that ends my part.
All right. And Jenny, I just did want to remind our audience, don't feel like you're sitting there trying to copy everything down and it's going to be gone after we go to the next slide. All of this information, the entire slide deck is available online, and so anyone can access that through our site at whatever point they would like to.
Right.
All right.
Afternoon. I'm Julia Rodriguez O'Donnell, and I'm an oncology social worker here at UNC Cancer Hospital. And beyond the management of cancer treatment itself, patients and families experience significant impact on their employment, whether they are going to continue working, take time off, or need to leave a job altogether. And those are very complex, challenging decisions for people to make, and some of which they have control over, some of which they don't. They're also being impacted financially and in terms of managing the logistical day-to-day activities in their lives, family activities, household responsibilities, as well as managing transportation. Many of the treatments involved for cancer involve a lot of back and forth to the hospital. And many of our patients here at UNC come from all places around the state, and some even from out of state. And that can mean hours of driving back and forth, trying to figure out lodging if they're going to be staying for a period of time, and who's going to take care of things at home while they're away. As well, legal issues that can come up related to treatment, which we'll be talking about later in our presentation. Next slide. Working during treatment. If working during treatment is a priority for someone because it makes them feel good to be working to the extent that they're able, or if it's a necessity for financial reasons, it's really important that our patients talk to their healthcare team and talk to their supervisor and colleagues at work. Of course, there's a lot of decisions that they have to make about how much do they disclose about their cancer diagnosis and treatment. And as a social worker, I really work to try and help people think that through. They don't necessarily have to disclose a lot to be able to get the accommodations that they need if they're going to continue trying to work. Certainly, they need to be thinking about how cancer and treatment will affect them and their job performance and their, simple ability to show up at work if they're going to continue working. If people want to tell more or less to their colleagues and supervisor, it's a very personal decision, and it depends a lot on the environment in which they work. Some really might consider it essential to disclose their diagnosis and treatment plan, particularly if they hold managerial positions or if they own their own company. Others consider that they don't need to tell a whole lot, and they prefer to protect their privacy and may even fear that a disclosure of a diagnosis of cancer could place their job in jeopardy. And that is certainly a real and valid concern, and we help people think through that, think about who allies might be, who trusted people might be that they can talk to, If they're not sure what sort of decision to make, whether there's someone in an HR department that they can talk to without necessarily having to tell everyone in their close work environment. So most important that people understand they have a lot of options, they have different ways that they can handle that, and we're going to help them sort through that and make decisions that are best for them. When people are ready to return back to work, whether it's returning back full-time or returning back if they've had to take a leave of absence, it's really important for them to understand that they can ask for accommodations. They can ask for lighter duty. They can ask for example, if they are still experiencing some chemo brain, which is a term that some of you may or may not have heard before, but it sort of refers to some cognitive fogginess and sometimes memory and processing difficulties that can accompany chemotherapy and even last beyond the end of chemotherapy. They may also be experiencing continued fatigue. They may be able to work, but they may need some accommodations. They may not be able to work a full day. They may not be able to work every day of the week. So helping people regain the confidence if they want to return to work and are able to, that's possible, and that there are ways to seek accommodations around that. In addition, the more stressful the job is, the more difficult the reentry is, and that's something we try and coach people around. A lot of our sort of high drive folks, they either want to continue working or return to work sooner than they really are ready and able to do that. So for them, it's a lot about coaching them, take it easy, give yourself the time that you need, because this is really a time when you're focusing on healing and recovery. And if you're able to do that financially, then that can really be an important time to take the rest that you have available to you. In addition, taking time off can be a complicated process just in terms of the logistics of, am I taking intermittent FMLA leave? Am I taking a more extended absence? Am I going to utilize short-term or long-term disability benefits? And so really helping people talk with their employers and their HR departments about what the options are, reminding them they don't have to figure it all out on their own. There's a wonderful resource called, an online resource, cancerandcareers.org, which has a lot of assistance for people who are trying to make these decisions and sort through their work and treatment options. And so that's something that we often point people to. In addition, people are trying to take into consideration, well, if I take time off, am I going to be able to keep my benefits? One of the things that UNC is able to offer some of our cancer patients is that if they, in the midst of treatment, aren't able to keep their health insurance, we have a program that can sometimes assist them to make COBRA premiums while they're going through until they can get back to work and back on their benefits. So these are just some of the creative ways that we try and help people work through this. Moving on to the next slide, paying for medical treatment. The cost of cancer treatment is extremely stressful for people, even with the best of benefit packages. If you're on Medicare only as a 65 and older individual, you're looking at 20% copays unless you have other supplemental coverages. A lot of general commercial plans through employers or through the Affordable Care Act on the exchange are going to have some kind of deductible or copay for treatment, and people are often worried about that the minute they learn of a diagnosis. And one of the things we try and encourage them to do is, while we're going to help them, come up with a game plan around that and sort through that, we don't want them to be panicking about finances at a time when they need to be thinking about healing and recovery. So we try and mitigate some of that, and by encouraging them to kind of slow down, let's think about everything that you've got in terms of benefits and resources and what else might be out there that we can help you apply for, which is a big part of where social work comes in the cancer treatment continuum. Some of the treatment costs include physicians, seeing the doctors. If they have hospitalization stays, room and board for that. Once they're doing their outpatient clinic visits for radiation therapy, chemotherapy visits, labs, scans to see how the cancer treatment progress is going. All of that's going to be associated with costs and charges. The treatments itself, radiation, chemotherapy. But in addition to the treatments themselves, family living expenses is a huge issue for our patients. They're worried about how am I going to pay my rent, my mortgage, my loss of work is going to have a huge impact. How am I going to manage child care, utilities, all sorts of things. Even food insecurity comes up for a lot of our patients who are already experiencing poverty previous to a cancer diagnosis. Transportation to and from clinic appointments is also a major concern for people, particularly those that live out of the area are trying to figure out how they're going to afford coming back and forth. Some of our patients don't even have vehicles, and so we're looking at getting rides from people and trying to provide support through gas card programs and such. Finally, longer-term care can be extremely difficult for our patients to pay for. Older individuals who may be covered by Medicare but don't have long-term care insurance plans, or who have Medicaid, but for whom, when that runs out, they may be looking at expenses for nursing care at home or help at home to assist with families who are trying to care for their loved ones. So treatment can be paid for using a number of ways, obviously insurance plans, Medicare, Medicaid, Affordable Care Act plans, private insurance coverage plans, and we'll sort of go over each one of these. It's really important that we encourage our patients to find out exactly what their coverage covers, what their liabilities are and what is covered by their unique plan. And so many people really don't understand what their plans cover for something as vast as the treatment of cancer. And so we encourage them to get in touch with their HR departments, with their insurance companies, and then kind of take it step by step so they can make informed choices through their cancer treatment. Some individuals have purchased additional cancer insurance plans. That's mostly through employers. And we've had numerous cases where people sort of forget, and then they remember that they have these plans, but they don't even know what they cover. So again, getting people to find out what their benefits are, bringing them in, talking with our financial counselors, and getting a better idea of what are the areas that they are going to need assistance with. Breaking down some of the different insurance coverages that people might have to explain some of them. Medicare is federal health insurance program for adults ages 65 and older and individuals who are disabled for 2 years or more. And that's where they're going to have oftentimes 20% copays, which can add up quickly when, a day here at the clinic could run a couple $1,000. 20% of that is no small chunk of change, and it can add up. We try and refer our elderly and disabled to government programs that can help them make sense out of this and also maximize the coverage that they are eligible for. Which brings us to Medicaid, because we have a lot of, being a state hospital, we have a lot of lower income individuals and families that come our way for cancer treatment who may qualify for Medicaid, which is health insurance that's run state by state and is for lower income individuals who are below the 200% federal poverty level, which is based on household income and the number of people in your household. And so we help people sort of figure out if they might be eligible. We refer them down to their local social service office to apply. That can be a several month-long process. And in the meantime, bills are they're getting bills at home. And once they get on Medicaid, those bills can be covered retroactively. But it's very stressful for people. And so we're, kind of coaching them and talking them through that process. And working closely with the Medicaid offices to try and get those applications moving through the system. Medicaid will cover most treatment costs, but there are a lot of ancillary services that are very limited under Medicaid. Like, for example, if people need physical and occupational therapy, Medicaid will only cover 3, physical therapy or home health visits per year. So that obviously isn't enough for somebody that needs more extensive care at home, either during treatment or even after the conclusion of treatment. So we're working with them around grant assistance programs and volunteer programs in their communities that can help with this. There are lots as well of different types of Medicaid. It's confusing even for us that work within the healthcare system to keep it all straight in our minds. And so we try and really rely on our local social service agencies to kind of be the experts on that. And one of the things I really like to emphasize when talking with folks like yourselves who are in training and coming into the healthcare field is that thanks to health insurance reform, insurance companies can no longer deny insurance because of pre-existing conditions or terminate your coverage because of a cancer diagnosis. And even though this has been in law for a number of years, people are still afraid, oh no, my coverage is going to get canceled, and we have to remind them that that's actually against federal law currently. And so no, that's not going to happen. As well, there are over 600,000 North Carolina residents and millions of United States residents who have gained health insurance coverage and who previously might have been rejected outright. So that is a benefit that they have, and their premium rates are not going to go up because they have a cancer diagnosis. So that's something that's really important for people to understand. As well, UNC and other hospitals, but particularly UNC, we have a financial assistance program for people who may have health insurance but can't afford all of the copays and deductibles, or people who don't have any insurance at all and who are unable to afford the premiums for, say, insurance through the health exchange. We do have a charity care program that they can apply for that lowers the cost by percentages based on their income. So that one of the things we're very proud of here at UNC is that we treat anyone regardless of ability to pay. Not having insurance or not having the means to pay is not going to slow down your ability to get treatment in a timely manner. The cost of chemotherapy and cancer-related treatment medications is another stressor for patients, and we also have a pharmacy assistance program to help with the cost of that, which our pharmacist will speak to a little bit later. Finally, living expenses and transportation costs are a huge concern for our patients, even those who, if cancer weren't on their plate, they would be doing okay. They're making it, like many Americans, they're making it paycheck to paycheck. But when a cancer diagnosis comes along, suddenly they're faced with a loss of income, even a loss of one person's income in two-income family can be devastating in terms of paying bills like rent, mortgage, utilities, car repairs, things that come up. And that brings us to some of the assistance that we try and help patients obtain when they're in treatment. Let me move ahead. Okay, so there's filing for disability, be it short-term or longer-term, when patients are unable to work for extended periods of time. And we encourage people to talk with their human resource departments about that. For patients who are working part-time or they don't have those disability benefits, they can apply for Social Security disability, although through their local Social Security office, although it's really important for people to understand that you can only get Social Security disability benefits if you are expected to not be able to work for at least 1 year. So for some people, they don't meet that eligibility criteria, and they're really just kind of stuck without any kind of disability benefits during the time of their cancer treatment. And there's also some other eligibility issues, and it takes months to get through that process. So Generally, we work with patients as social workers to try and help in that interim period with some of the expenses they have, just to kind of keep their lives going and to keep treatment going. And this brings us to the community foundations that we work with people around, including the Caring Community Foundation, which is a local foundation here to North Carolina, which can provide patients with assistance with rent, utilities, car repairs, things that would get in the way of them receiving their active treatment. There's also grants for specific types of cancer, for example, 1 in 9 and 1 of us for breast and gynecological cancers, and helping with similar sorts of expenses. There's also Stomp the Monster, a local chapter here in North Carolina that can help with food and gas cards, and in addition to lots of other federal grant programs that we help people apply to and that can offer assistance. So here's a list of some of the ones we utilize on a pretty regular basis to help patients, which you'll have a copy of. Transportation and medical treatment can be very challenging. For our patients who are in daily radiation treatment, we are able to get them a special, if they live 75 miles away and are Medicaid eligible, meaning they have a certain income eligibility, we are able to get them $5 a night hotels so that they can get their treatment every day and not have to be driving back and forth hours a day in the car. We can also help get them gas cards through cancer patient assistance funds and so forth. With that, I'm going to turn it over to Cindy, our patient assistance counselor.
Thank you.
Yeah.
If I could have the keyboard,
Yes.
please. Thank you very much. Yeah. Good afternoon and welcome. I am Cindy Rogers. I am the Patient Assistance Coordinator here at the North Carolina Cancer Hospital. And I'm happy to talk to you today about some legal resources that our cancer patients oftentimes find that they're in need of. One issue that's important to everyone, not just cancer patients, but particularly anyone who has been diagnosed with what might be known as a life-limiting diagnosis like cancer, is whom would you want to have make medical decisions for you if you cannot speak for yourself? And what kind of care would you like to have at the end of what might be the very end of your life? And there are documents that can help patients to articulate their wishes, and those documents are called advance directives. And advance directives include both what's known as a healthcare power of attorney and also what's known as a living will, not to be confused with a testamentary will. The healthcare power of attorney allows someone to appoint somebody to make healthcare decisions for them if they are no longer able to speak for themselves. And then the living will allows a person to say, what kind of healthcare would you like to have if your healthcare team determines that it's nearing the end of your life? And these documents allow you to put in writing and to communicate with your family, friends, loved ones, and your healthcare team what your wishes are. Now, we here at UNC are very fortunate to be able to have a project that helps with prepare these documents. And most healthcare institutions do provide some means of helping to acquire these very important healthcare documents. We have here at UNC, the UNC Cancer Pro Bono Legal Project. It's a fairly unique project in that we are working with Legal Aid of North Carolina, which is a statewide law firm, and also UNC Law School. And we're providing this free legal service to help counsel patients about these particular documents, prepare them for them, draft them, get them witnessed, notarized, and if they wish, put into their medical records so that their healthcare teams understands what their wishes are. Smaller community hospitals may look to their chaplain service to help provide this service. Our patient relations office here at UNC will actually has a notary service, and so if patients need a notary that they've already thought through these issues, they know what they want, they've already put them in writing, the hospital patient relations department can help notarize them. So these are legal documents, and they're important. And it's important to have someone who can actually speak with patients and help them think through what their wishes are during this stressful time. Other end-of-life documents include a legal or what is also known as a durable power of attorney. Other documents are testamentary wills and or trusts, and things dealing with guardianship of minors, such as a standby guardianship. These are very specialized documents. They are not necessarily relating to one's health care, and so most hospitals do not provide a service to prepare those particular documents, but they can be very important in helping our cancer population and our patients and their families prepare for end of life, and in doing so, helping to relieve a lot of the stress that they may be feeling about their diagnosis and help them to sort of take that worry off their plate about what might happen in the future for their families and focus more on their own treatment and care. So we're fortunate in that in our partnership with the Cancer Pro Bono Legal Project that by working with a local law firm or our statewide law firm and the law school, we're actually able to help also prepare this legal or durable power of attorney for patients. And we found that to be a really wonderful service, but again, not something that most healthcare institutions will help to prepare. A nice resource for people in the community who are wanting to explore more about what these documents are and helping them think through the different issues that these documents address is this website, caringinfo.org, that is part of the National Hospice and Palliative Care Organization. You can actually download our North Carolina state documents from that website, and it also has, just a lot of resources and information so people can help think through these important issues. So a cancer diagnosis may carry with it, actually, as Julia has discussed, just a variety of legal issues. And these include insurance appeals, employment rights, medical leave of absence, access to health care and government benefits, guardianship of children, and estate planning. And these legal issues can really cause a lot of worry, confusion, and stress for patients. It can be quite overwhelming. As has already been discussed, a cancer diagnosis can be financially devastating. And as cancer patients are if they're facing a loss of a job or a denial of benefits such as Medicaid or disability or a loss of housing or utility cutoffs, there may be legal remedies. And I think oftentimes patients don't realize that the issues that they're facing actually are legal issues and that there may be legal remedies to them. And then, of course, then the question is, where do you turn to get help with those legal issues? And here on the screen we have a few resources. The North Carolina Bar Association does have a lawyer referral program, and this is a statewide program. And so anybody can call the North Carolina Bar Association, or they can go to ncbar.gov and they'll help you find a lawyer in your area. Now, they may not be you may find a lawyer who will be willing to give you a free one-time conversation about your problem and then talk about whether or not they can help you going forward. But most likely this is the private bar, private attorneys, and there would be a charge for their services. Legal Aid of North Carolina assists low-income households with civil legal needs involving basic human needs such as income, safety, shelter, and education. They also offer some self-help clinics, such as for divorce. So a really good resource is Legal Aid. They do have very limited resources. They are not able to help everyone. But if you're experiencing a problem, it's a good idea to call them, go through their intake number that you can find at their website. A really great resource is the Disability Rights Legal Center. And this is a national organization. They have as one of their branches the Cancer Legal Resource Center. And they can provide a telephone assistance with issues relating to disability. And many people don't know that cancer is considered a disabling diagnosis under the Americans with Disabilities Act. So very important if you feel you're being discriminated against because of a cancer diagnosis. Here's a resource to help you find some information. And then we also have a disability resource center in North Carolina, and you can Google that and get information on that as well. Julie has touched on many of these charitable financial resources in her conversation, so I won't spend too much time on this, but the Cancer Care is a national organization that offers small transportation grants. They're very, very helpful. Patient Advocate Foundation I did want to bring up because not only do they have some co-payment assistance programs, they also administer grants for other organizations, and they help to also can deal with denials of insurance. So if your insurance has denied your treatment, you can go to the Patient Advocate Foundation for help. And with that, I'm going to turn it over to Michelle. And I think there you go.
Okay. Well, thank you very much. So I'm Michelle Gardner. I'm the pharmacist. My primary role is in the UNC Cancer Hospital Adult Oncology Infusion Clinic, where I counsel patients who are going to receive a new chemotherapy treatment for the first time. And the reason I do that is so that mostly to tell them about all their the potential side effects, just so they can know what to expect. And we kind of go over some measures they can take at home, either just with some home remedies or, common sense or dietary changes, or also some prescription medications they could take to help them through some of their side effects that they might experience. And also to let them know when they should call the physician. And I find this is very important because a lot of people have the misconception that if they're going to get chemotherapy, they're going to be really nauseated and vomiting all the time, and that's just what happens. And part of my role is just to let people know that no, it's not like that anymore. We have really good medications, and you should speak up if you're having these symptoms. And I also educate people on how to take their medicines the best way possible to get the most benefit from them. So that is what I do. But today and as far as getting some reliable information from the internet, because the internet is full of all sorts of misinformation, I'll just refer you back to some of the websites that Jenny referenced at the beginning of the presentation, with the ASCO, which is the American Society of Clinical Oncology, or the NCCN website, which is the National Comprehensive Cancer Network. And those are just excellent resources for information to patients and families about, real information about your chemotherapy and expected side effects and what you can do about them. But what I chose to concentrate on is some of the cost associated with having cancer that is not directly related to coming to the clinic and getting infusions, but also some of the unforeseen prescription costs that can hit patients and are sort of unexpected. So first thing is, as far as community resources for patients with cancer, it varies by individual hospital. There's not any overarching resource or program that is used in North Carolina. So these are some of the major regional hospitals here, and they all have, most of them refer to some sort of charity care or assistance that's available for patients who have cancer and who don't have insurance, and it might be just like a 35% discount, for people who don't have insurance, so that they can have just their copays or their cost at the gate isn't reduced, because if people know that they're going to have to pay out of pocket so much. But it's widely variable. So wherever you or your patient, whoever is seeking care, you have to kind of know what resources are available at that specific entity, because it's going to be different for each one. Now, specifically, I also want to touch on that people can be kind of caught by surprise by these medication costs, because there's for medication administration, there's 3 different costs and fees that could be applied. There's what's incorporated when people receive medication while they're admitted to the hospital, and then there's medication costs that might be different for when they receive the medication in an outpatient clinic where they're not admitted to the hospital, but they came to the clinic or hospital to get their chemo treatment for the day and they're going home. And then the last thing that really catches people by surprise is how much money they might have to spend on medications that they are meant to have filled at a retail pharmacy and take home for home use, either because they're actual chemotherapy pills or for supportive care. And so I just chose to concentrate on that. So home medications are different. At UNC, we have a charity care program, but that covers outpatient clinics and inpatient administration, but it doesn't cover outpatient prescriptions or medications that people have to get filled at a pharmacy and take home to use at home. And so most of the entities that I listed on the other side did not actually advertise that they had a specific outpatient pharmacy drug benefit available to uninsured patients. And at UNC we do have one, but it's not included in the charity care program. So it's confusing for patients because they'll come to the clinic and they've filled out all their paperwork for their charity care, so their radiation's covered, their chemotherapy in the clinic's covered, but the supportive care medications they have to take to prevent nausea at home are not covered by that. And so that's a separate application they have to fill out for the pharmacy assistance program, or the PAP is what we call it. So some qualifying things that the patient has to have in order to even be considered for PAP is they have to be uninsured. Their household income has to equal less than 200% of the federal poverty level. And the benefit if they do qualify for PAP is that they can get many, many medications that they would need for just $4 a month, which is a great benefit. One of the, I think, slippery slopes or some issues we have at UNC is that people only have to have a federal income level at 250% of the federal poverty level to qualify for charity care. So some patients fall in this kind of small window where they qualify for charity care, but they don't qualify for the pharmacy assistance, and that can be an issue for them. Okay, so just to give you an idea for how expensive things can be that you might have to take at home, and other medications that are supportive care and associated with making sure people make it through chemotherapy with minimal nausea, and then minimal, really reducing the risk of getting sick or having different infections. These are some of the supportive care medications that are very common. One of the ones that get prescribed is valacyclovir or Valtrex. We give it to pretty much everyone who's being treated for lymphoma, leukemia, multiple myeloma. And what it does is it helps prevent reactivation specifically of shingles, which is a very big concern for people who are going through certain treatments. Another expensive medication, you can see it's $200. Over $200 is that retail price for 30 of those pills or a month supply. For posaconazole, a month supply of that can cost about $6,000 cash price. And we give that to people who are at risk for contracting a fungal infection with their chemotherapy. Cefpodoxime is just an antibiotic, about $500 for a month supply of that. If some people need to take that to make sure they don't get a blood infection or any other infection during their chemotherapy. And then occasionally people who are getting treated with a few medications, if they have any evidence that they've been exposed to hepatitis B, while they're starting certain medications, they have to take the entecavir or Baraclude at a cost of $1,300 a month in order to prevent them from contracting potentially fatal, fulminant, full-blown hepatitis B symptoms while they're going through their chemotherapy treatment. So these are just all things that most people don't even consider. And then, you go to the pharmacy and you're like, oh, that'll be $6,000 because your insurance doesn't cover this, or you don't have insurance. It's overwhelming for people. Affording medications for home use. So these are cash prices for other things. So these are the anti-nausea medicines that a lot of our patients need to use. So I know that Zofran or ondansetron for 30 tablets at a large chain pharmacy can run about $140 cash price. Which is just really not affordable, not sustainable for people. If ondansetron didn't work, people turn to this patch, $600 for one patch, and you might need 2 of them to go through a month's worth of treatment. And then another nausea medications, Aprepitant or olanzapine, are used for nausea, and you can see the expensive the amount of money it would cost to pay out of pocket for that. So one thing, the trick that I've learned only by working where I work is that frequently, buy local. The small independent chains or some smaller grocery stores with pharmacies often offer better cash prices for patients. So if they don't have insurance, or if for some reason their insurance is not covering a particular medication, and sometimes we get in a bind where they need the medication, but we don't have time, and they have insurance, but we don't have time to do what's called a prior authorization, or filling out a lot of paperwork and arguing with the insurance company to convince them to cover a medication. These are some of the price reductions I managed to get from some small independent pharmacies. So instead of going to the big chains, try this small independent. You can see the Ondansetron went from $140 for 30 to somewhere in the $10 to $20 range. The Valley Cyclovir greater than $150 to down to $25 to $30. Olanzapine greater than $100 for 12 and down to $9 to $20 for 12. And that's the cash price from the chain is like a chain, and then the independent pharmacy on the other side, to show you just some tricks for how to be able to afford medications. So there are some things out there for copay cards. The caveat to this is that you actually have to have insurance. If you don't have insurance, you won't qualify for this. But for people who do have insurance, and this also just gets people by surprise. They have insurance, it's pretty good, but then the medication is quote unquote covered, but it's still, $150 a month or $200 a month out of pocket, and when it's covered by your insurance, which is, again, just unsustainable if people have to keep doing this month after month after month. So these are just some options for copay cards. For the Sancuso patch, which is a anti-nausea medicine, patient would pay $20, and then the copay card will cover up to another $150 per month. For the Baraclude, which is to prevent the hepatitis B, for some patients, the Bristol-Myers Squibb will cover up to $400 a month for a copay. And the Noxafil, which is the very expensive antifungal, which costs up to $6,000 a month for cash price, the patient would pay the first $90, and the card can cover up to $1,500 per month. But again, these aren't available to everyone. And then these are just some manufacturer assistance programs. This is a Bristol-Myers Squibb Assistance Foundation for their particular medications. These are some of the options out there. And then Pfizer has one as well, manufacturer assistance, which you have to call and register for. So this is, there's also a company called GoodRxcom, where like a nurse or a pharmacist that you work with might be able to go in here and get you a special one-time only discount card for something like Zofran that you can take to your regular pharmacy and have a better cash price on it than maybe even your insurance will give you. And so this is one option. It's great. And then the last thing is just a guide through the wilderness. There's a website called Needy Meds. And then they educate and empower those seeking affordable health care. And they have information. You type in the drug you're interested in learning about, and it brings up information about all these possibilities. They'll direct you to pharmacy assistance programs, copay cards, which manufacturers have, where you can get a $4 generic, like which store can you go to, and then various coupons and rebates and more that might be available from a specific manufacturer. And back to Janine.
And these last slides we'll go through real quick because I know we're short on time. This is a list of here. I'm going to move through these pretty quickly. These are some of the UNC-based support groups that are available for patients and families. These groups kind of speak for themselves. This is a list of community-based support groups that are in the Triangle area available for patients and families. This is a list of peer support programs. Peer support programs designed to match a patient to or a caregiver to someone who may have walked a similar path in terms of diagnosis and treatment. They may be similar in age or gender or location. Peer support programs provide just another layer of support for folks for the emotional and coping support that they may need. We've had wonderful success with several of these on this list. It's from the comfort of your own home instead of showing up to a face-to-face support group. And then also being diagnosed with cancer between the ages of 14 and 40 is a very different set. You're dealing with a different set of issues in life. So these are some support organizations out there for adolescents and young adults. That's what AYA stands for. And then there's some after-treatment adventure retreats, too, for younger folks to kind of get back in tune with moving on with life after treatment. And again, here are more cancer additional support resources here. Just to highlight a couple, Cleaning for a Reason is a national organization that offers free house cleaning once a month for 4 months for women who are undergoing any kind of cancer. It doesn't have to be specific to GYN or breast cancer. I love this graphic, and we talked just two minutes about survivorship, picking up the pieces after treatment is done. Let's see, cancer survivorship. These are some wonderful cancer survivorship free programs to help folks get on with their life, and post-treatment retreats. And we are done. Sorry.
Wow.
We are very passionate about what we do here. But I do hope that by seeing 4 of us, it takes a village to help patients get through their treatment, and it's truly a collaboration and a partnership with your team members as you move into your own health careers. So don't be shy to partner with people.
All right. Thank you all so much. It's tremendous. We don't have, I apologize, our camera doesn't go quite wide enough to get Michelle. Either it's Michelle, it's one of the two of us. So we'll pan back to you shortly. But I want to see if we can get to just 1 or 2 questions, if anyone had one. And if you have to leave now, we understand, and we are recording this, so everything, if somebody has to leave at this moment, but wanted to come back and hear the questions, they will be on the recording. So just to remind our listeners, you can go ahead and text UNCCN to the number 22333. One time, you'll get a little message that says join. If you've already done that, you're set, and you can go ahead and text your questions to us. While we're waiting for a couple of them to come in, let me ask one. At the beginning, there had been some discussion about bringing somebody with you to these conversations. These can be some of the most important conversations one could ever have, and you may be least prepared to really take in everything that's being said to you. So how can one engage a family member or another support person in this role when you have these important appointments?
I think to approach it just like you would when you are approaching any big decision-making or milestone in your life. Most people feel like they need the help and support of their family and friends when they're faced with such decisions. And to know that you're not on a specific timeline. I mean, your physician, your team will say, please get back with us with your decision by X date. But the ball is left in your court. So you take your time to go home, to talk about it, develop your list of questions, route back to your healthcare team about what am I exactly going to experience? What does my treatment protocol look like? How often and when? Because, for example, radiation is typically, for most cancer patients, over a series of 6 weeks, every single day, Monday through Friday. And if you don't know that ahead of time and you're driving in from far distances, it can really impact a lot of issues of your life.
All right. Thank you. We do still have time for maybe 1 or 2 questions if anyone wanted to text those in. Let's see. I had a couple that I jotted down. So many resources out there, and sometimes it can be confusing and overwhelming. How does one make sense of what resources are really most reliable versus those that it may be less than reputable?
I think and please chime in if you will, if you go to a certain website and it has .org, .edu, .gov, those you can count on are trusted and reliable.
Cancer.net is maybe...
And cancer.net.
Yeah, an exception to that, but they're a wonderful resource. And certainly asking us here at the hospital, which ones are your go-tos is a good way to find out, what are the most reliable ones.
A research tool I like is also if you find the same information in multiple websites, it's likely that that's going to be more trustworthy than something that you find that's a real outlier, that's something that's really out of that mainstream of what you're finding in the other websites, that's one way of saying this is probably more accurate or trustworthy.
Sure. That makes sense, and know that those outliers are there. So beware of that.
Mm-hmm.
All right. Well, we should really go ahead and wrap up. We want to thank our presenters. This has been fantastic, and we'll leave our audience with the presentation that has the links to all those many different resources that you had discussed. So they'll have that with them, and that will stay on our website indefinitely at unccn.org. Let's see, just a couple of other things in closing. We have our next lecture coming up, and this will be on April 24th at 1 p.m. This is Caring for the Patient and Family Experiencing Pediatric or Adolescent Cancer. This is with Andrew Smitherman, MD. We hope you'll be here to join us for that. And if you're not available at that time, to come back and to watch the recording of the lecture. Thank you so much for participating. As we mentioned, you can find us first and foremost on the web at unccn.org, and there you'll find links to everything else. All right. Thank you again to our panel for being here today. And until next time, have a great afternoon. Thank you.